Before we move on to the nuclei of the cranial nerves, I will first would like to just go over one more thing in this brain cross-section. So this was the thalamus, the lentiform nucleus, and the caudate nucleus. I forgot to mention that the space in between them, this white area here, so I'll make it dark, all of this white dark area, so here, this one here has been pushed too much this way, so imagine there is going to be space in between them. Okay, that is your internal capsule, and there are three types of fibers that are present within the brain. There are association fibers. Association fibers connect structures on the same side of the brain. So for example, looking at the right hemisphere, association fibers would connect some structure here with the structure down here, so their fibers run anterior-posteriorly on the same side. That's association fibers. Then you have commissure fibers. Commissure, just like you had your I'm not sure if there was 1M or 2Ms, but it's commissure fibers, and they connect structures on two sides of the brain. So for example, the corpus callosum is an example of commissure fibers, connects structures on the left hemisphere with structures on the right hemisphere. The anterior-posterior commissures are another example. The intermediate mass connecting the two thalamus is yet another example. Okay, and so there was association fibers connecting same structures on same side, commissure fibers connecting structures on two sides, and there is projection fibers that connect structures from the top of the brain to the bottom of the brain. Okay, so they run up and down. So here is a brain in side view, okay, like a boxing glove here, and they would connect structures up here with the structures down here, so they run up and down. And the internal capsule is an example of projection fibers, because they, as we see when we talk about the motor pathways, the projection fibers allow information to come up from the spinal cord and then via the internal capsule get into the higher parts of the brain. So this would be your internal capsule here. So this is the brain stem. This is posterior view. Remember, we already looked at this before. Looking at from the posterior view, we have the thalamus here, two of them, the third ventricle, pineal gland, superior colliculi, inferior colliculi, so this is the midbrain, and then you have the middle, superior and inferior cerebellar peduncles. This opening is the fourth ventricle. The cerebellum has been removed, and we see there is a structure, and there is the facial colliculi, and this is the medulla oblongata with the posterior median fissure, posterior lateral sulcus, and posterior intermediate sulcus. So the nuclei for the 12 cranial nerves are as follows. Cranial nerves 1 and 2 do not have nuclei because they go directly into the brain. Remember the optic tract and the optic nerve? They go directly into the brain. However, cranial nerves 3 to 12 do have nuclei. So the nucleus for cranial nerve 3 is here. Okay? That is a somatic motor. So if you take this and divide it in half, so if we're going to divide all of this in half, I'm going to show the motor components on the right side and all the sensory on the left side. So all of this we will have the motor nuclei, and all of here will have the sensory nuclei. Okay, like that.